Hi. Well, let's begin. This is basically a kind of a tip which I wish to start once a week, once every 2 weeks. Send out a tip how to use the YNSA technique or the scalp acupuncture in a better manner. So this is the first tip. It's about keeping things simple. In the last few weeks, I've been treating a patient who's suffering from stroke, post-stroke, about 1 year ago, or 8 months to 1 year, and he's been suffering from paralysis in his left limb, lower limb, and the hand. And every time, now he has a bit of a slight movement, and every time I approach this patient to treat him at home, of course, every time I put in a needle, he felt more heaviness in the foot or more heaviness in the hand. And he was unable to even move. What the slight movement he had kept on disappearing. I tried the epsilon points, I tried going by the full protocol of the YNSA, and every time I came out with nothing. And I was getting very, very frustrated by treating this patient. And already I came to a situation when I used to put in the first needle and I asked, okay, move your hand, move your leg. He said, oh, I feel it's a lot heavier. I felt very, very frustrated. So I told the patient, okay, I'm going to come back next week, and if I don't see any improvement, we're going to just leave it at that. And actually, this is where I had the breakthrough. I approached this patient again a week later, and this time I decided I'm going to buy this. I said, why when I started out practicing YNSA I had such good results, and today I found it a bit more difficult to get a good result? And so I think it was I used to keep it simple back then. Sometimes when you know too much of the technique and you lose the simplicity of the technique. So what I decided to do with this patient, so I started out by decided only to use the basic points, and I actually started out by using TCM body acupuncture. I wanted to strengthen the stomach chi, so I went on the foot that was suffering paralysis, and I looked for depletions in the muscle, the tibialis anterior muscle, which is corresponding with the stomach meridian. And wherever I felt a depletion, I inserted the needle. And I stimulated the needle until he had some sensation. And I kept on doing so for about 10 minutes. And then I asked the patient to move his leg. He did not manage to move his leg. So then I decided to put in the YNSA. What I done in this technique, I needled the brain points contralateral to the side which is suffering from the paralysis. So he's at the left-hand side of the foot and hand suffering from paralysis. I needed the brain points on the right-hand side. I gave a bit of a stimulation to the needle, and I asked the patient to move his leg now. What he said, he feels a bit lighter in the movement of the foot, but still it is he cannot move it much. The next, I needled A point, C point, and D point on the ipsilateral side, on the same side, on the left-hand side. And I get also these needles, I stimulated them for a few seconds. The next, I asked the patient to move his foot, and he moved his foot. It was easier for him to move. He could bring his foot into a full flexion, a hip flexion, which he could not do before. And I was astounded. And this is actually why I mean keep things simple. So I was also, wow, it works. I'm back to myself. And this was the lesson I had from this patient who told me to keep things simple and don't try to complicate things. And by using the simplicity of the technique, you will actually sometimes get the best results that you're looking for. I'm speaking about this because it happened to me in other patients, not the same symptoms or the same syndrome which the patient was suffering from, but the same idea that I was coming to the same patient, trying the protocol, epsilon points, cranial points, and see no results. When I went back to the simplicity of the technique, these patients showed improvement, great improvement in the symptoms. So that's why this is my first tip for you all. Keep things simple and work according to the diagnosis in the elbow or the neck, but always keep the idea of the technique simple. Thank you. Have a good evening.